Good evening. Thank you for joining us. It is a controversial treatment, but many MS sufferers in Alberta have been demanding access to it. Tonight, they may be one step closer. After incredible public pressure, the Alberta government is paying for a $1 million study into what's called the Liberation treatment. It won't test the treatment on patients, but it will track the progress of those who've gone out of country to get it. Here's our health specialist, Karen Owen.
Donna DeLorme has had MS since 1996. She went to Costa Rica this summer for the Liberation treatment. She says she's had some improvement in her balance and overall sense of well-being, but she wants another treatment. She's just the type of patient the province wants for its observational study. The province says the study is a first step. It is not ready to test the treatment on patients yet.
We want to be sure it's safe. Now, we have had lots of anecdotal experience with patients having had this procedure and then reporting complications. I can't go into the details, but I can tell you that there's substantial anecdotal evidence of risk. That's one of the reasons this study is being done. And how much is there? Is there a lot, or is it just a little bit? Are we just hearing about the bad things and the rest are fine? We don't know.
Donna says she will participate in the online study, but she's disappointed that it's taking so long to make the treatment available in Canada. She thinks the province is stalling.
So it's another 3 years of us having to do our own research and us having to travel all over the world and spend our own money and fundraise to get treatment so they can observe us for 3 years. I don't think it's I think it may be a little bit of a step forward, but I don't think it's that great of an announcement.
Crystal Phillips has relapsing remitting MS. She's currently in remission but wants to see the research move a little faster. She too will participate in the study if she can. The province does want both people who have had the treatment and those who have not.
I see a rush for myself personally. I can't even imagine the rush that people feel when they're already debilitated, and I have a lot of close friends with more progressive forms of MS, and my heart breaks when I think about their situation and how urgent they must be feeling.
The Liberation treatment is based on Dr. Paolo Zamboni's research, which suggests that the majority of MS patients have blockages in veins in their necks that prevent blood from draining from the brain. The treatment opens the veins. However, while many MS patients are convinced that the Liberation treatment is safe and effective, scientists like Dr. Feasby are not.
I don't know if it works. That's why we're looking at the studies.
So Karen Owen joins us now. Karen, this is a start, but as we heard there, this isn't exactly what people are looking for. They wanted a clinical trial. So will that ever happen?
Well, you know what? The doctors are going to be following this research and other research that's taking place across Canada. They'll want to see if the treatment is safe. Now, the health minister has already promised $6 million for a clinical trial if that's the way it goes. So it could happen. Okay, but all of the feedback they're going to get back on this really is going to be anecdotal. So how do they compare it to see if this really works or not? Well, they're really not going to try to determine if it works because, as you say, these people are going to different countries. They could be getting slightly different procedures. What they really want to know is it safe? They also just want to track the results and track the side effects because, as you probably know, one Canadian has died following this procedure. Okay, Karen, thank you very much. Today's poll question asks what you think of the province funding an observational study. Should they have gone straight to clinical trials?